without further ado, I'd like to introduce Dr. Chris Croley and CEO Arash Kalantari.
Hello.
Hi, everyone. Thanks again, Arash, for having me. I'm really happy to be here again with you guys today. You know how much I love your device and the technology.
Thank you, Chris. It's always a pleasure, Dr. Crowley. And I know that you had, I think, as you said, you had 3 Plexr sessions today, right? 3 treatments today?
3 today, yeah.
Why you don't start from those 3 clients that you had today?
Sure. I think it goes to the heart of what we're talking about today, building a fan base. When we talk about fan base, it's really patients are, consumers, really. That's what we're all trying to do, is bring in consumers, patients, clients into our practice. And, how do we build that fan base or that client base that'll come in and ask for these treatments? So it's interesting, the 3 that I had today, one of them actually was all the way, drove about 4.5 hours from up near the Atlanta, Georgia area. Based on some of the results that she had seen from another client that I had treated that was a friend of hers. And the other 2 patients were local. So I did one lower blepharoplasty, one cat scratch technique that we can talk about, and one upper lid blepharoplasty. And so these are really more like the self-surgery techniques that we really love doing with the Plexr. It's a great device for that. And our patients are loving the results. So clearly they're not just right immediately in our area, but coming kind of from all over the region. And we only got to that level by kind of building this, I don't know if I love the term fan base, but I think it is a client base that we've grown, I think in our practice, primarily through word of mouth. And so we're going to talk about that some in the webinar today, but that's been one of our core strategies for building our client base.
Perfect. So today we want to more basically dive deep into the idea of basically what is the strategy when you want to really start your practice or you want to expand your practice, right? There are different type of indications. And at the end of the day, as a medical professional, what you offer is clinical results, right? So, and if you imagine you are like in a store, so your products are different kind of clinical results. So the more product you have in your shelf, the better sales you can have. So I always say, like, how many items do you have in your menu? And so I wanted to ask you to explain more about how you suggest to design a menu or a treatment list for a med spa or clinic. Mm-hmm. How that matters.
Yeah. I mean, many of you that are logged on the webinar know that I have a really kind of a passion now for teaching the business side of aesthetics as well as the clinical. And, I do that because of how much that I learned over the years through trial and error, and hope to shorten that curve. So one of the hardest things I think in the beginning is deciding what to bring in, what to offer, what capital equipment to invest in. And I think you start with kind of just the basics of what, every med spa offers. I think that you have to have some of the core things, and that's going to be your injectables, your neurotoxins, and your fillers. Any of you who have been in this space for any amount of time know that the margins on those aren't great. And so you have to do other things then to kind of offset and to really make your med spa profitable. And so there's a few things that I look into. One is, what are patients looking for? What types of procedures, what types of, technologies, results are they searching for in your area? And there's a lot of different ways that you can, resources that you can use to find that. Look at what people are searching for. But in general, we know that there is a trend towards doing things that are more bioregenerative than necessarily our just basic fillers where we plump an area up. So now I'll start looking into what are the things that I can do that are bioregenerative. What are the injectables? What are the energy-based devices that I can use? And from there, I look at like my margins. How does this fit into my practice, and what results does that give me? And so that's where Plexr came into play. So it is something that fits into this bioregenerative technique that we can use in multiple modalities. And so we can use this from something that's minimally, invasive or non-invasive, really. So there's a Plexr shower where they come in with almost zero downtime, just a little bit of redness afterwards, and go right about their business that day. And they look great then the next day and get their real results. 4 to 6 weeks all the way up to something that is more fully ablative. So like the procedures that I did today, the upper and lower blepharoplasties, those patients will have a little bit of dark spots in the areas that I performed the treatment, for maybe around a week, up to 10 days on the one that I did a little bit more aggressively, but most commonly we see that for 4 to 7 days. And then they have great results with that. And then the cat scratch, which is somewhere in the middle, it's semi-ablative. They're going to be red a little bit longer. They'll have a few dark discolorations on there for a couple of days. And their real results are going to come, probably somewhere around 4 to 6 weeks as well. So when they're going to really start seeing that collagen stimulation. So as I look into what are patients seeking, they're looking for things that are bioregenerative. What devices fit into that? The next thing I'm going to ask myself is, what is the disposable or consumable pieces associated with that device? So I may have a great energy-based device, but if I can charge $2,000 for a procedure, but it costs me $1,000 or $1,200 in consumables to perform the treatment, then I've really, not made a lot of money, relatively speaking, for that space and time. Whereas we look at this device, our consumables are under $20, per treatment. And so depending on which tip you're using, around $20, and the rest of it's going to be profit. So now we're doing something that's bioregenerative. When we get into the ablative forms, we can actually remove tissue, and we can create lifting results with this, where we're actually going to as we remove the tissue and it heals, that collagen formation is going to lift it up. And so that's what patients are wanting: minimal downtime, lifting, biorejuvenation. And I can do all of this with a device that has under a $20 consumable associated with it. So those are some of the things that I considered when I was bringing Plexr into my practice.
Perfect. So basically the other viewpoint that we can add to this, to what you said, are like there are different kind of treatments, right? So for example, as you said, like Botox and filler, you have to provide those, well, because people are asking for it. But as you said, you don't make that much money, and also these indications are very competitive. Now from the other side, there are other basically treatments which are not easy to do for many people, even though with training it's easy to do, but people are asking for it. And for example, acne scar, So later today, I'm going to show you one of those acne scar results with Plexr. So now, one of the other things that lots of people in Empire, they are just the startups and they want to, explore this business. And one of the things that I was exploring recently was like, for a med spa to really make money and explore and being able to survive, you need some basically client base, as you said, or fan base, who really they're loyal to you and they are fan of your treatments and basically your procedures. So overall, how many of these kind of people you need in your practice to make sure that, okay, now my business is picking up?
Mm-hmm. Yeah, that's a really interesting question, and something that I really go over a lot in the business class. And so I think we often hear about medical people not being good business people, and we see the numbers of how many people go into business and then close within a few years of opening. And I don't think it's because medical people are inherently dumb. We're actually pretty smart people and have to go through a lot of advanced training, whether you're nurse practitioner, physician, but we don't put a lot of time into the business side of things. And we take these classes and we pay for our insurance and our license and all these different random expenses without putting them all together. And so I really, the way that I coach on this and train on this is to say, think about your ideal schedule. How many weeks per year vacation do you want? And so from that, you can determine how many weeks per year do you want to be open? How many days per week that week would you like to be open? How many hours per day do you want to be open? And so you add all of your costs together for your insurance, your liability, your classes, all of the fixed costs. And then you simply divide that by the number of weeks, by the number of days, by the number of hours. And you can see then how much you have to generate per hour just to stay open. And that's to break even, not to make a profit. And then you start looking at your treatments and what you're going to offer in your practice to generate that money to keep your doors open. And so that's going to look a lot different for someone who's doing, let's say they decide to open a practice with neurotoxin only. They're going to have to do a lot more patients. So when we say how many per day, if we're having to look at what it takes just to break even, that provider is going to have to be generating, 20 to 30 patients every single day, probably 40 something weeks out of the year at minimum to stay open, versus when we start looking at some of these procedures that have higher margins on them, higher ROIs, I can see fewer patients per day if I'm doing Plexr on all of them, because I have a much bigger margin there. So my profit margin is going to change some. And so the number that I need is going to change. And so, the way I look at that is, where do I shift my marketing dollars? So they're going to find me just because there's a lot of people marketing Botox and fillers, and I'm going to have that on my keywords. Those patients are going to find me. But what I'm going to do is put much more marketing dollars into these procedures that are generating a larger margin for me, so patients are aware of that. And so if I treat one Plexr patient in an hour, I'm going to make more profit than if I do 3 Botox patients in an hour. And so I can have those numbers are going to look very different depending on what type of services that you offer. And so it kind of ties back into your first question, as I'm looking at how many people I need to make my practice viable. It's going to really depend greatly on my service mix, and the services that I choose that have larger margins, I can do less marketing and get fewer new patients in than, so I don't have to have a fan base of thousands to do some of these things, versus I may need that if I'm doing injectables only.
Okay. Okay. Perfect. So my estimate was, like, if you really have like between 300 to 500 people for procedures like Plexr, which they really come to you every year for 2-3 times, and they spend $5,000 to $10,000 with you, you're good. You can survive, and you can make over $1 million, and and you can grow from there. Okay, so let's see, what is
And
the...
it's interesting, Arash. I mean, that number probably to a lot of people on the call and listening, that number may sound unattainable. But I just was, and you were with me, we were in New York this past weekend teaching classes, and I saw a provider, and they were telling me how, basically their practice had how many patients they had seen and how it grew from one month to the next. And they were really worried because the numbers were still, under 100 that they had seen in that month. But when you looked at the rate of growth and the time that they had been open, I pointed out to them, it actually is really, when you look at this, you only need 300 to 500 to really support a practice with some of these higher price procedures. I'm like, you're on the right path. You're actually, don't switch too soon, because you've had pretty rapid growth and you're on the right pace. So you're not going to have 300 to 500 in your first month, but with the right service mix and the right marketing, you can easily get to that number within your first 6 months.
Exactly. Basically, it's about the quality of your clients, not about the quantity of you. Like, you don't want those kind of Groupon people,
Mm-hmm.
Yeah. So many people, when they want to start, marketing is scary, right? And to me, as somebody who I'm in this field for almost 3 decades, marketing was always easy because it was with the word of mouth. And still, beside Instagram and Google and all of that, still word of mouth is the best, and it is the 100% successful marketing. Tell me a little bit more about this, please.
Yeah. So it's really, core to my practice, because that's how I built my practice. And you have had this conversation before. We started 16 years ago. And so social media wasn't around. There was some social media, but not really in the terms that we think of it today. So marketing looked a lot different back then. So we actually did very little advertising. We were growing by word of mouth. I was working many more hours at the hospital. Jerry was in nurse practitioner school. So we had limited time. And so because of word of mouth marketing alone, we got to a point that we had to take down advertising. We had to take down, websites, because we couldn't accommodate the number of patients. So at that point, we weren't ready for the growth that we were having. And Jerry needed to finish school. We needed to get more infrastructure in place. And so it's interesting now, as I watch people try to, grow their client base in a different manner. I say, don't forget about word of mouth. That is your strongest marketing. That is going to be your strongest referrals. Because with people who are finding us through other means, whether it's Google or, Instagram or Facebook, any of those other means that we're going to advertise, we're having to vet ourselves to those patients. So they find us, and now we have to kind of prove our worth. We have to convince them as to why they should see us, why we're going to provide the best services for them. We don't have that problem with word of mouth. So when somebody has referred you because of their positive experience, that you have already been validated in that patient's mind. So once they show up, they are already, in essence, they've already went through that process of how am I going to decide on who to see. We have patients travel from all over the U.S. to see us. Like I said, I just had literally just this afternoon, someone that came down from outside the Atlanta area, and that's not uncommon for us. And almost all of those are word of mouth referrals. It's not that we don't get them through other mechanisms, but it's almost all word of mouth. So that goes back into how do you get word of mouth marketing? That is where you have to really make sure that the services that you are offering provide the results that you're promising, and that you are providing outstanding, customer and patient experience for everybody that steps foot in your practice. Otherwise, you're not going to get the word of mouth. And to me, that still is, one of the most important ways that you can build your practice. Unfortunately, the downside of that, it's slow. Because with word of mouth marketing, you can build a very strong, a very loyal fan base or client base. Those patients will stick with you. I have patients now have seen us the whole time we've been in practice here. And the referrals that they send you tend to stay with you for many, many years. And so the lifetime value of that client far exceeds what they're going to pay for one, treatment. And that's really what you're looking for. So you don't have to market and get new people in over and over again. But unfortunately, that is a slow path. That is going to take usually to build up, this 300 to 500 routine steady patients. That can take you, 1 to 2 years at least. And so that is where other modalities come into play. So that is where we're going to look at, how do we really set ourselves apart, and how do we use other things such as social media, Google keywords, traditional print media, business to business marketing, all of those other things that we can talk about. That's where that's going to come into play to try to speed up that process of acquiring new clients, and then making sure that the services that we provide those new clients are going to generate further word of mouth marketing.
Perfect. Exactly. So I liked when you said that it takes time, because that's real. So now, other ways to basically speed up this process, despite of the digital marketing, is like business to business. So business to business is also a very successful way, especially if you engage with other businesses which are not just like you, like for example, with a hair salon, with other med spas or fitness, basically classes or things like that. So we basically have this idea of referral system, which they come and they also join your fan base. And this is something that we can talk in another day. Now, one of the things that Dr. Croley, I always try to teach people is come up with signature treatments, because you are spending all this money on marketing. And when you, for example, if you are advertising, I don't know, Morpheus, for example, right? So it's a very, very famous device right now. It's a very good device too. So you are marketing them, you're not marketing yourself. So down the line, if something happens to that name, you're losing all of your marketing dollar. Now, if you come up with a signature treatment, for example, you mix this treatment and you combine it with this and make up something. I'll give you an example. Like, for example, Glass Lift is the name that we made with the combination of Plexr shower and topical Botox and actor reverse. So it is not a name of any technology. It's a signature treatment, So what do you think about the role of signature treatment and how one can come up with a perfect signature treatment?
Mm-hmm. So, first of all, I love signature treatments. I love trademark names. And then I quickly realized it's easier said than done. So early on in our aesthetic journey, someone mentioned this to us, and we had advice from someone, and I didn't take them up on it. We didn't really realize the importance of it. So it was many years later that somewhere one of my mentors, somebody I really look up to, they had a trademark procedure, and I was like, wow, that's brilliant. And now that individual makes more on selling the trademark name and licensing use of that name than they ever did in their clinical practice. And so I was like, that's brilliant. And when I look at the treatment, it's something that many people do, but they have this signature treatment or this name associated with it. And now to use that name. So we did kind of take some lessons from that, and we did start developing signature treatments. And initially we had some like names that weren't, I don't think they were that great, but they were still our treatment. And I was surprised how patients like latched onto that, because I was like, that's not even that great of a name, but they would ask for that treatment because their friend had the treatment. But then as time went on, I think we got better at it, and we kind of learned some marketing tips. And, for us, one of our more successful signature treatments has been in the sexual health arena. And we did one called Performance P-Wave, and I'll talk about it. I would love to tell you, that it's something super unique to us. But it's also a treatment that's, a combination of different things for men's sexual health issues that many providers will perform similar or exactly the same procedure. But what we did was take it out of the erectile dysfunction category, put it into performance. And so rather than advertising around that, we advertise for guys doing something with performance. It is insane how that changed our marketing, because now we trademark that name. So no one can use it except for us, unless we license them and allow them to. And so now all around this area, that's where we market Performance P-Wave. It's out over and over again. And so we have guys coming from all over because they want this procedure that only we perform. And I'm like, well, I mean, actually, you can get something similar. And so I agree with the Plexr. We do the glass lift. You can do all sorts of signature treatments. So I encourage you to, when you get anything, whether you're bringing the Plexr in or doing your neurotoxins, come up with something. We've even done this with our IV infusions. So our practice is skin and tonic. And so once I kind of realized the importance of that, all of our IV infusions have some sort of cocktail name associated with them. So it plays along with our theme, skin and tonic, and all of those are our tonic. So, we have the tonic for your collagen boosting, for your hair growth, for energy, for dehydration. But all of those are associated with some sort of play on a cocktail name that's just, again, a signature treatment for us. And so as silly as that sounds, the patients come in and they really identify with that, and they identify it then strongly with your practice. And so I think signature treatments are incredibly important. Sometimes you can partner with the company, and if you're using their device, it helps because they've developed this signature treatment for you that only you can offer. So in the case of the Plexr, glass lift, I think, is a really good one to use. So if you get the device, they allow you to use the name glass lift. But, if you can still come up with your own signature treatments and call them what you wish using the device, and then that's only yours. And so it's something that people can't take away from you.
Exactly. So I'm excited to show you guys some of the new before and after pictures that I received from our Plexr users. So this is one session after 2 months after one session Plexr acne treatment.
That's amazing. I think I haven't seen this one yet, Arash.
Yeah, this is very new. Yeah, 2 months after one. This one is famous now.
That one's mine. I've seen that.
Yeah, this is amazing. I always, when I look at this picture, I ask people, do you think it's a CO2 laser resurfacing? They say, yeah, of course. And I say, no, it's not even ablative. It's not even ablative. So
Yeah, I need to get her to come back and get a third one now and see what she can look like. So she really, I mean, I told you I was impressed with that. So that's when I share that one. That's, a patient, for those of you who haven't seen her. She was in my practice, and she came for a training session that we were doing with the Plexr. I was training my esthetician on the Plexr shower. So this is the nano ablative or minimally ablative. I do think I always point out with this, one, the results are phenomenal. Like, I'm happy with them. She is over the moon happy with it. But I also think it's really important to point out that it's the products, I think, that we combine it with. And so this is a Plexr shower, but we combine this with a really great product. It's the one, the Acto Reverse, that we carried. So she had a great result with that.
yeah. So I want to go to Acto Reverse very soon because I have another picture for that.
Mhm.
So before I get into that, this is always basically very important to me. Which areas of aesthetic are less competitive? Which basically, if I'm starting in new med spa, maybe I want to start with those areas. So it's going to be easier marketing, easier everything, and more ROI, you know?
Well, I mean, for sure, the most competitive is your injectable, your neurotoxins, and your fillers. There literally seems like, every day that there are, 4 or 5 more places within a few miles of us that are doing this, and that's happening all over the country. I think it is the core. So it's hard to stand out in those areas. So I think when you start looking into the, energy-based devices in general, they're less competitive because it does require some kind of capital expense up front. So the machines are pricey. And so, looking at where do you invest in that technology is really, I think, challenging for new providers. But I think it does set you apart because not every injectable, in fact, only a small percentage of injectable practices offer some sort of energy-based device. And we're talking about lasers in general. And so lasers and different sorts of energy devices. And so when we look at that, then I look into where can I invest in a technology that offers me a broad range of services that other people can't find in my area. And so, right now, Plexr is this plasma technology, and Plexr and specifically is really kind of growing, but it's still not in all parts of the country. So it's still an area that can really set you apart. So I would say, number one, what sets you apart is having some sort of energy-based device that's going to be different than every injectable that everyone on the market's offering. And then number two is, what are the devices out there that offer you a range of services, from something that is basically non-ablative, minimally, invasive and zero downtime, to something that you can do a soft surgery with in your practice. And so I think that's where really Plexr fits in. Obviously, there are other devices that do that, but your capital expense is going to be much higher. And John can certainly talk to you about, pricing and, finance options and all that at the end of this.
Perfect. So to basically continue that, also, like for example, skin rejuvenation is very popular, and every energy-based device does it. But when it comes to like microsurgeries, like this case, like removing a mole without a scarring, or removing a stretch mark, or keloid, C-section, overall scar management, these are things that are not really competitive. No one wants to deal with them because they are not easy to handle, right? Can you tell me your experience about this mole removal and how difficult it was?
Yeah, so this patient had had this her entire life, and really her parents and grandparents said it's a beauty mark. It's, nothing to do about that. And as she got older and obviously it grew some, it got larger. She had a biopsy at one point. It made sure that, it wasn't anything suspicious. And but every person that she sought for removal of this told her surgery was the only option. And she was going to be left with a big scar above her lip. So she was always torn with, do I have a big scar above my lip, or do I deal with this actual mole? And I think she was beautiful before. I think she's beautiful after. And if knowing this individual patient, she really has a beautiful, beautiful heart, and just somebody that I think is a dear friend. But she didn't come to me as a friend. She was there as a client, as a patient, and now we've become friends after that. And she said, I really, as much as I want to feel confident, I don't. I turn away in photos when I get asked to take a photo. I don't want to look at the camera. I want to make sure that I'm on this other side. I don't like being in pictures with my children because of this. When I go to family events, everybody tells me how beautiful I am, but really the whole thing I'm thinking about is this on my face. When my husband goes to kiss me, I'm wondering, is this going to be in the way? Does it gross him out? So it really impacted her psychologically in so many different areas. And she had struggled with this, for decades. And so I was like, we have this option, and this is the largest at that point, the largest mole that I had attempted to remove with it. And I called you about it. We talked about it, and I was like, it's really right above her lip, and I'm very concerned about this, leaving a scar. And as you can see, we took it off, and there is nothing left there, residual at all. And she had a tiny little, I mean, small little brown spot that's totally gone now. And it's totally changed her life. That text over there is what you can see from her. She gave me permission to use it, but that was a text that she actually sent us, afterwards. And so, to me, this is more than just treating a wrinkle with Botox. Like the satisfaction that it gets from having a client that feels like that now you've boosted their confidence. She's like, I can pose in photos. She just went to Portugal to visit family. And so she was like, I was there, I was with all my cousins, I look better than all of them. So yeah, this is a device that can go from what you saw before. And we really had drastic results on that patient you saw before from non-ablative. And this is, more of a soft surgery indication. So something that we do to remove some sort of lesion surgically.
Perfect. Perfect. And also, these are some of the examples for upper eyelid blepharoplasty.
That's very similar. That's obviously, I don't have the after photo, but that's very similar to what I did today with one of the cases was an upper blepharoplasty, about that degree of laxity.
I just wanted to make a quick mention about treatments like the removal of that mole. Speaking of the word of mouth, there's certain things that people deal with aesthetically that they feel like their entire life there was nothing to do about it. And when they have a successful treatment that really gives them new life, they talk to everybody about it.
Mm-hmm.
So that's the kind of customer that you're really looking to to have in your practice and be able to treat them.
Yeah. It's not really related to this because I did the treatment before I ever got the Plexr, but in terms of word of mouth marketing, probably one of my most successful before and afters was a combination therapy. And I'd use an energy-based device along with some injectables, and it was over a 6-month period. And that patient is a flight attendant. And it is crazy because what she came in for originally was a thread lift. And I said, we can do a thread lift and I can reposition this tissue, but it's really not going to do a lot for your overall skin texture. It's not going to do a lot for the tone of your skin. And if we do this series of treatments, I feel confident you'll have a better result. And her results are really crazy. Like I said, the 6-month before and after, and literally 6 months between treatments. But talk about word of mouth marketing. That flight attendant has flown all over the world now, and I probably treated her, this was probably 9 years ago. And I cannot tell you how many other, not just flight attendants, but their families and people that she's met on her trips. And she tells everybody about us. And so we even do travel packages now where we basically discounted a similar level to what we would do for our member discounts, but we market it as a travel package so they can apply that to their hotel or their flight or whatever they want, and we do some sort of discount of their treatments. But we've got dozens, if not hundreds, of patients off of that one because exactly what you said, John. Like they have it, it's life changing, and then they go out and they continue to talk about it over and over and over for years.
Yeah, beautiful. So this is another basically before and after pictures that I just got today. It's from Legacy Med Spa. And this is just Plexr shower, one session, and look how life-changing it is. Now, the second one that I'm going to show you, this surprised me a lot. Look at this. So this is just the text from the Legacy Med Spa in their Instagram. Says 1 week after Plexr mold removal with Plexr and active rigorous biostimulant treatment for skin tone and texture repair, no filter. They mention no filter because it's like very much different. So the improvement is like insane. And you see that they removed all these moles, from around the eye. And also they remodeled the whole skin. This is just amazing.
I think that is amazing. I wanted to interject with a couple of questions regarding the moles, since we're on that topic. I had a question asking how many treatments are required for that last patient that you treated, Dr. Croley, and also when you are doing mole removal, as much as I know you're not charging insurance, they were questioning if you would have charged insurance for something like that.
Yeah. So first of all, I'm totally a cash-based practice. So there's a few things with the removals that you have to be, at least concerned with. So we're sublimating this tissue. We're removing the tissue. So there's no way that I'm once we do that, there's no way to send that for any kind of biopsy or tissue sampling. So, you want to be fairly confident and have a conversation with the patient. that if it is something, suspicious, that they're going to have some sort of plan to follow up, to monitor that, or to get biopsy of whatever's left behind, because we're removing that entire amount of tissue. I'm not billing insurance for it. It's not that you can't, just like you can do other things, but I find that my practice setting is not set up that way. And so we're not doing any insurance billing at all for those sorts of procedures. It's a strictly cash based for my practice. Did that answer the question, John? I forgot halfway through the answer what the second part of the question was.
No, you did great. We were just talking. I think as far as the number of treatments.
It was one. Yeah, I knew there was a part of it I missed. That was one treatment. And so these are mostly for these type of lesions. Almost all of them are one treatment. Now, occasionally for the larger one, I actually talked to her and told her that she may need a second treatment, because I didn't want to be super aggressive as I got down to the base of the lesion. I wanted to make sure that I didn't leave any kind of scarring there. And so I told her, but actually when I saw her at the 4-week follow-up, there was a little brown spot. And then I saw her like 2 months after that was the next time I saw her. And it had totally resolved, so that we ended up, it was just one treatment, nothing else.
Yeah, perfect.
And so I find when we're doing any sort of biostimulation, biorejuvenation, so like you saw the first patient that I had, and like we see in a lot of patients, kind of that are coming in for overall skin texture, tone, and just biorejuvenation, that is a series of treatments. So that's usually going to be 2-3 treatments, and we're going to have some sort of ongoing maintenance, meaning that, if they're younger, making more collagen, we're probably going to need to treat them maybe three times in a year. If they're older and have more collagen loss, or they have a lifestyle that's not really going to be conducive to, maximal collagen production. So if they're a smoker, a sun worshiper, those patients are going to need more treatments for maintenance. So they're going to probably need somewhere in the, 5 or up to 6 treatments in a year. And then you have the people who are in between. So kind of our young, healthy patients are going to be maybe 3. Our older patients with poor lifestyle habits, maybe up to 6. And then somewhere, if you're middle-aged and pretty healthy lifestyle, you're going to be somewhere in that 3 to 6 treatments per year. And that's for ongoing collagen production. That's very different than if we're doing a lifting procedure. So if we're doing a blepharoplasty on the eye, if we're doing, where we're removing tissue, those, I usually say are probably 2 treatments. So I'm going to do 1, and the first one, we're going to get a pretty good result from that, but I'm going to follow up with them. And usually on that second treatment, I'm going to be able to adjust anything that I need, remove more tissue, really get the most optimal result, usually on the second one. And if it's a mole removal, whether it's a cherry angioma or I should say a skin lesion removal, so something like a cherry angioma, or even a wart, or a skin tag, all of those things are usually 1 session. And at the follow-up, we decide if they need kind of a touch-up on that, or if we got everything with the first session. But most of the time, that's 1 session.
Yeah, and also just to complete, the reason why we go for 2 sessions for skin rejuvenation and skin remodeling is that it's about collagen production and tissue regeneration. This process takes time, so that's why you want to do it in 2 sessions, so you get the most. And so now this picture is 50% Plexr and the 50% basically active reverse. And the effect of active reverse here is really astonishing. So I wanted to talk a little bit about active reverse here as a cell signaling system. Dr. Croley is using this product for a long time now, and I think it's one of your favorites.
Yeah. And we talked about this. And so I know a lot of you guys have taken classes with me at Empire that are on the call now. Some of you may not have, but I'm very resistant and reluctant to bring on any new technology. I love devices. I have a lot of devices in my practice, and I've bought a ton over the years. But at the time I originally heard about Plexr and was Arash was talking to me, I'm like, no, I'm not interested in buying anything new. But at that event that I met him, he happened to have his daughter, and she's a wonderful human as well. If you guys get a chance to meet her, I hope that you can meet her at one of the events. And she was talking to me about these products. And I'll be honest, I think I love entrepreneurship. I love young entrepreneurs. And I'm like, I know she's working here with her dad, but she has her own company that he's kind of helping her get up and running as well. And I was like, let's support her and let me just get some of this and try it, because she was going to sell me some of the products, and I wanted to get her, some credits under her belt that weekend. And so brought him back. And so I started using this product way before I got the Plexr. And so I did it again, strictly to support her. And I was thinking in my mind, it's another hyaluronic acid. We've got a lot of them in the practice. I've tried a lot of them over the years, and it's probably going to be similar results. And so I brought it back, and we started using it in our microneedling patients. And so our esthetician was like, you need to get me some more of this product, because the patients are loving these results, and they're saying it's very different. They think that we've changed the type of microneedling that we're doing. They don't know what's different, but they're getting these results, and I need more of it. And so we started using this, I don't know if it was 6 months or a year before, maybe 6 months before I actually got the Plexr device. And so we were using it with the microneedling, and clinically seeing a difference in our patients and seeing them request it. And so the ActoFeel is a product line, and within that line, they have different products. So the ActoFirm is one of the products, and ActoReverse is another one that you have right now. And so you can see here, the ActoReverse to me is, I know that, Arash, you don't describe it exactly like this, but to me, this is kind of like your ActoFirm on steroids. So it's basically kicked up a notch. And so you're going to have your hyaluronic acid serum, but you're going to have also amino acids in there to support collagen production. You're going to have your glutathione to help with pigment issues and pigment changes. And so it really helps with collagen production. It has a CD44 signaling molecule to really stimulate the fibroblasts to produce collagen. And so I think that is really key, as Arash said in that second patient that's not mine, that we just saw, that probably half is the Plexr and half is this product. And I really feel the same about that patient that you saw of mine. So the older white lady that we saw at the beginning, that really had those dramatic results. I combined the shower with this ActoReverse both times, and one time with neurotoxin mixed in it. And so I do think that I have to give credit to this, because we've seen it with our microneedling and with using it with Plexr. And this is what we use for our microneedlings now in our practice, is this product.
Beautiful, beautiful. And the cool thing about ActoFeel basically product overall is this CD44 receptor. So, and I want to go over that very quick. So we have this receptor CD44 in our fibroblast cells. This receptor is sensitive to basically measure the amount of aging, and the way that it measures the aging is through this process. So first of all, when we have aging, we got fragmented collagen. So that fragmented collagen in our tissue is trash. We don't use it anymore. So there is a specific enzyme which comes and then dissolves this basically fragmented collagen. Now, the presence of this particular enzyme is equal to aging for CD44 receptor. So when CD44 receptor sees this enzyme, sends a signal to fibroblast cell that aging is happening, let's produce more collagen and elastin. Now, in ActoFeel brand, we have fragmented hyaluronic acid, which are identical to this fragmented collagen. So when you send these products into the tissue, the same enzyme has to show up and dissolve them, which activates the CD44 receptor. And that's how it activates collagen synthesis. It's like, imagine that you inject filler all over your face, everywhere at the same time. And you can see it in this case. So this is before, this is 2 months after one single session, basically topical application with Plexr shower. And she lost 5 pounds in these 2 months. And still you see volumizing effect and brightening effect and whitening and all of that. So I think we have time for a few more questions, and then that would be the webinar of the day.
Okay, wonderful. I'll go through some of the questions that we just had pop up. So someone wanted to know how microneedling is different, pros, cons versus a Plexr shower. And as far as ActoFeel goes, using it in conjunction with microneedling, if you apply it before or after.
Okay, so yeah, I'll take that unless you have something you want to add on that, Arash. So in terms of the actual process itself, I apply it after the microneedling. So we use the microneedling to create a mechanical trauma. So the needles are going to create opening channels within the skin. And then we put it on the ActoFill after the product procedure. So whether it's ActoFirm or ActoReverse, we put that on at the conclusion of the procedure, let it soak in all the channels. And we also send some home with the patient that they're going to apply usually within 4 hours of the procedure. So it's a two-step application. In terms of the Plexr shower and how does that differ from traditional microneedling? So there's a few things. So first of all, it is in general a more comfortable procedure than microneedling. And so from patient's tolerance standpoint, it's more comfortable. Second of all, we're using plasma energy to basically create these nano channels or nano openings, which is going to help with our product delivery. And so conceptually, we're basically, creating channels instead of with a mechanical trauma with the needles, we're doing this with plasma-based energy. So there's a couple of things about that are beneficial. So we know that it can be very inflammatory with the number of needle sticks that we use. And so the more aggressive we are with microneedling, the more trauma that we create, which, sometimes it can lead to problems with scarring, especially in our darker skin type patients. We can get things like our post-inflammatory hyperpigmentation. So we got to worry about that a little bit. And so we don't really see that with the Plexr shower. So we're using plasma energy, but it's spread across this triangular shaped tip. So it's spread across a large surface area to create these micro openings that are going to now allow us to deliver the product. And really, whether we're, doing this for, if we're doing this for collagen production, your product that you're putting on at the end is just as important as the way that you're creating those channels. And so what I like about the Plexr shower is I'm able to create those channels with this plasma energy without having the mechanical trauma on the skin that they're going to now have to go and heal from. And there could be some problems with inflammatory changes. Now we do microneedle in all skin types 1 through 6. We Plexr shower in types 1 through 6. But I don't worry much about pigment changes with our shower as I do with the microneedling. In terms of strictly a business aspect of this, with our microneedling, we're going to have to numb the patient. They're going to have to sit with that on them. So depending on your practice setup, so if you're in a salon suite or a shared space, then that's going to take up time that you could be treating a patient while they're having to sit with numbing on for their microneedling. For the Plexr shower, we don't have to numb at all. So we just straight away do the treatment. And so in general, I could see 2 patients per hour. And so in the same time, do 2 Plexr showers as it would take to do 1 microneedling. And so, when we start looking at results, the results are typically what our patients are telling me, what I'm seeing, superior with the Plexr shower to traditional microneedling. But their microneedling has been around for a long time and patients are familiar with it and still request it. So I had a little bit of trouble in the beginning getting patients to see the difference in the two. And so what we did is put it as a similar type of procedure, although I think the Plexr gives superior results. Our price points, we put around the same area. And now what we've done is gradually increase that because we did this word of mouth, right? It took a little bit of time to get some of our own patients, not just showing what the company shows, not just showing what, MedResults is going to give me as before and after, but now actually being able to speak to it and say, look, not only personally have I seen this, here's some patient testimonials, here's some actual results of what we've done. And I show a few pictures, like the first one that you saw on the slides from my practice, and they see that and they realize it is a different procedure. It is superior. They don't hurt as much and they get better results. And now I can charge more for that. And so we're still in that process of adjusting our prices up. So that was a little bit hard for me conceptually in the beginning to think of where am I going to position this? And it actually was a little bit difficult for my staff to have those conversations. And that only took a few months because literally you start seeing those results and then it speaks for itself and you don't have to continue having that conversation over again. Arash, how do you coach practices on comparing those two?
So I mean, you nailed it actually. The one thing that I have, the difference between microneedling and Plexr shower is that microneedling is not ablative. So you are not removing the tissue. So you're just causing a micro injury, micro trauma. With Plexr shower, you are actually, what we call Plexr shower is nano ablative. So it is ablative, but it is microscopically ablative. And it is very important because when you remove the tissue, you have to regenerate the tissue. You have to recover from that removed tissue. And that is the source of that lifting that you see in people. And also, the other thing is, after Plexr shower, the skin is just like a dry sponge. It sucks everything in. So compared to microneedling, which after that, skin is like a wet sponge, which is bleeding and is not willing to receive more. So I suggest for people who want to use microneedling with Plexr shower to also apply Plexr shower before microneedling, you know? So apply it before, do it while this, and then also after. And also for one of the questions that we had about the puffy eyes, I have this picture. So which I think it gives the answer for the puffy eye, and basically these kind of scenarios, Plexr is very, very effective. Hopefully in one of our next session, we're going to talk about more soft surgery techniques of Plexr. And yeah.
Great. Just a real quick last question. When you're doing a treatment that's going to potentially require multiple treatments, would you charge a single price, or would you build out multiple prices for subsequent, like a package versus a single session pricing?
Yeah, so I recommend, I mean, again, this is going to be dependent on what type of treatment you're talking about, right? And so if I'm talking about something like a biorejuvenation where they're coming in and I want to do a series of showers, and I tell them they're going to need 3 or 4 in a year, I'm usually going to discount if they pay for those, all of those up front. If this is something where I think they're going to need like 2 treatments to get the final result, and I really feel it's important that they get the second treatment, then I'm also going to charge for that all up front, bill for it, and include that second treatment. And the reason that's important, not just with this, but literally with anything you're doing in aesthetics, if you know that they're going to need 3 treatments to get their result, but they come in and they pay you for 1 treatment and then they don't see results, there's a % of those patients who will forget that you told them you need 3. And they're going to say, I just paid you $1,000 for something, I don't see any results. And they're going to come back and get the second and the third treatment. And so then they're just going to say that it's still a lot of money. They still paid you $1,000, but they didn't see the results. But in reality, they never even finished the treatments that you recommended. So what I do is recommend that you think about the treatment that you're providing. And if you know that it needs 2 or 3, do that in a package where they're going to pay for that up front, and it includes a second and third one. So that way they will follow through and get the treatments needed to get the results. And you have a big enough margin on this that you can easily do that. So you need to factor that in up front. But if this is something where it's a 20-year-old and they're coming in and the 2 or 3 treatments over the year, for some collagen stimulation, it's not a mole removal or something like that, then I let them pay for it as they go along, because I know that it's not necessary that they get 3. They're probably going to continue to get good results regardless of what I do. But if somebody comes in for a mole and I'm going to charge them, whatever I'm going to charge for that, $500, $800 to remove that, I'm probably going to do the second treatment if they need any touch up on that and not charge them for it, because I've already charged them to remove it. If they come back and they have a little residual there, I'm not going to say, oh, it's $500 to $800 again to take that little piece off or that little spot that I left the first time. So, it's not a straightforward answer that I always charge everything for the number of sessions. It really looks at what is the results they're going for. And that is what they're paying me for. They're paying me for the results. And so if I need to see them 2 to 3 times to get the results, I'm going to make sure that I charge them enough up front to cover those visits so they will come back and get them, because I want to be able to give them the results that I'm promising them.
Okay.
Arash, do you recommend something different with that?
No, it's exactly what I would do, the same. The other thing is Plexr shower treatment and any non-ablative, it's kind of, I don't want to use this word, but it kind of works the best. It is addictive. So people who get the result, experience basically Plexr shower, they want to repeat that. You don't need to try selling them the Plexr shower. It's painless. It gives you immediate result. There's no downtime, no problem. You have lifting, you have rejuvenating, you have skin basically toning, all of that. So why not, So you don't need to really push to sell them. They will come, they will pay you the price. And if you tell them that it's 3 times a year, they probably come to you every 2 months. They want to repeat that because they're happy with this, you know? Yeah. So John, before you start, I want to say something. It is our, I don't know, maybe it is our 8 or something webinar. So I wanted to have feedbacks. If our people can, you know, contact us and give us some feedbacks later on, we will try to basically follow those ideas and make it more productive for everyone. So yeah.
Yeah, I think so everybody who's joined this webinar and everyone who's registered is also going to receive an email with a recap. So you get a link to it. And if there were any questions left over, we'll be able to answer those in there as well. And we'll prompt you for some feedback. So we'd love to know new topics that you'd be interested in hearing. And we can continue to evolve and grow our webinar series. So we've been really excited about the attendance so far. It's been amazing. And Dr. Croley's been amazing, and Arash, awesome stuff. And so, yeah, just want to make a few mentions, unless you have anything else you want to say first, Arash.
I just want to say that the intention for these webinars is not we are trying to sell you Plexr or anything. It's more toward the basically scientific part of it. We are passionate about what we do. And so take it as more basically scientific kind of basic perspective. And then, yeah, that's all.
Yes, continuing education, and the more that you learn, the better your aesthetic journey becomes. So, for all more details, everything else about the device and specifications, talking more about your practice, how Plexr potentially is something that you'd want to include, we can book meetings together. You can use the QR code that's here. I also left a meeting link, and we'll be following up as well. So. We have a special as well that's through Empire, so we can offer that to you guys as well. We're offering $1,000 off, and in addition to $2,000 of supplemental products as well to the package. So really great deal at the moment. So love to hear your feedback. We'll be following up soon, and wanted to thank you all for joining. So thank you so much.